We are Muskegon County at Work, spotlighting workers of local governments throughout our county, revealing what it takes to make our communities comfortable and safe. Hello, everybody, and welcome to another episode of Muskegon County Municipalities at Work. Your host here, DJ Hilson. And today I've got a really special guest. I'm really looking forward to this conversation. We are talking with Kathy Moore, the Public Health Director here for Muskegon County. And so a lot to kind of dive into today, so why not just get started? Welcome, Kathy.
Thank you, DJ.
So as I always like to start my conversations with my guests, talk a little bit about yourself, who you are, how you got where you're at, and how long you've been there.
Wow. So I will start by saying right now I am the most senior county employee.
Wow.
I have been there longer than any of our 1,200 plus. I've been there for 35 and a half years. I started at Muskegon County Wastewater System at the time. I think it's called a Resource Recovery Center. I worked as an account clerk there, actually, and that's when I met my friend Steve Jackson. They were contractors, and I was helping collect and pay the bills there. Transferred over to the airport for 5 years as the accountant, and that is when they tore down the old chalet-style airport terminal and built the one they have now that they are now renovating, which really makes me feel like I've been around a long time. Transferred to health department, then to county administration, and back to the health department as the deputy health officer for a while. And I've been the health officer, public health director for the last 10 years.
So let's talk a little bit about, that is quite a diverse array of experience.
It is. It just helped me understand and appreciate the services and sort of the behind-the-scenes operations of county government. Very unique. And I can say before I started working for the county, I didn't really understand everything and all the work and effort and planning that goes into public service.
Well, and I think that's very, very well said. At all levels, but in particular at the county level. Yes. When you go to the county website and you look at all the county departments, all the things that are necessary in order to provide the services that the citizens require.
Absolutely, just the things that help make it come together. And a lot of times, our citizens don't know it's happening unless something's wrong. So a lot of times, if you're not aware of the county service, it's maybe because everything's going as it should.
So let's talk about the public health department.
Yes.
What exactly, what does that entail as far as services and personnel?
Yeah, so we are absolutely a conglomerate of services and activities and programs. From environmental health, where we inspect swimming pools, any tattoo or body piercing facilities, well and septic permitting for those that are not on municipal water, inspect all the restaurants and temporary food service establishments in Muskegon County. We have just a vast array of sanitarians, public health nurses for our clinical programs like immunizations, STI, sexually transmitted infection, management and follow-up, as well as other communicable diseases like tuberculosis. We also have what I call categorical program that's funded based on the category of funding that we accept, such as WIC, Women, Infants, and Children, Children's Special Health Care Services, and a vast of other maternal child health programs.
So, yeah, I think people don't quite understand, if they know at all, that the public health department exists.
Yes.
But the array of things that are required in order to make sure that ordinary Joe citizens like myself are are safe when we go into these establishments?
Absolutely. So our 3-prong motto is to prevent, promote, protect. Prevent diseases, promote healthy behaviors, and protect the environment. So we are not a direct healthcare. Like when we take action, we're actually trying to protect the rest of the citizens. So even if we give someone an immunization, it is to protect those around them. When we inspect restaurants, it's to assure that that restaurant is following safe sanitary guidelines so that the people that they're serving will not get food poisoning or any other ailment.
So obviously there's outreach services, but then there's in-house services. So let's talk a little bit about the in-house services that are available at the Public Health Department.
So in-house services are immunizations. First of all, though, DJ, we do encourage all of our residents to go to their primary care provider. So a lot of what we provide is episodic care for specific things. And we know that your primary health care provider knows you, knows our residents and all of their ailments. So we are there, though, if someone needs a flu shot, immunization for school. We also have our, again, WIC program. We have the Children's Special Health Care Services program, which any parents with kids with any special needs or care, we help to case manage and connect and to just really help that parent navigate sometimes some of the convoluted bureaucratic processes of getting care for someone.
Now, as you've described sort of the various things that the health department does, in my mind, there's quite a bit of staff that
Yes.
obviously you're responsible
Yes.
for. So,
Yes.
what kind of numbers are we talking about, and how does that work as far as managing the outreach and the in-house services?
So we have a budget of up to 72 employees, but what I've done over recent years since COVID is employ more of the temporary and direct contract, trying to stay a little more fluid with funding just in case. And during COVID, we actually saw more funding than budgeted. That's when we started with temporary because we knew it wasn't a forever thing. And then we've maintained temporary because it gives us a little more fluidness in responding and adapting. So 70, I think we're at 58 now, and then up and down depending on funding.
I mean, obviously, as it relates to funding and staffing, like all other county departments, you are beholden, if you will, to the county commission.
Yes.
And how have you found, I guess, over the 10 years that you've been the director, your relationship with the county board and their understanding of the importance of this department?
I really feel blessed in that regard that our county board, regardless of political affiliation, has always understood and supported. Like, I feel like our politicians, at least locally, are in it for the people, and we are public servants of the people. I appreciate, because I have that accounting business background, I appreciate the, sometimes the questions and the, encouragement to create more efficiencies in our operations. I do think it's needed. And I feel like, DJ, honestly, I've been here a long time. And with our county administrator and my fellow colleague directors, I just feel like we are in the best place as far as staffing and working relationships that I've ever seen.
Let's stay with that theme of collaboration and cooperation.
Yes.
Because obviously, I mean, you are, it's a county department, so you're countywide, which means that you're working with local municipalities.
Yes.
Talk to me about how that has been and how important that spirit of collaboration and cooperation is.
Absolutely important to leverage limited resources, and we all have limited resources. My philosophy is not to duplicate or compete with taxpayer dollars. And so I have a lot of partnerships with other health and human service agencies as well as municipalities. We several funding, like our senior millage fund, that is managed and facilitated through the public health department. We have a portion that goes directly to the municipalities so that they can plan and spend according to their senior residents. And sometimes it doesn't mean that they have to do something like very specific or individually. They can partner with some of the bigger grant-funded agencies like Age-Old Services that's providing services on a wider scale, but just customize it to their community. Or say, we want you to be here in our neighborhood instead of having a program where maybe the seniors have to drive into another area. So that's been a great partnership. I've got to learn different communities and understand that our rural community, we have about a third of our residents reside in rural areas. And I feel like, we customize sometimes programming to fit the biggest number of people. So we get the biggest bang for the buck, of course, when you focus on urban, so you can check off some of those. But we also have to we got to do more to deliberately reach our rural community. And I'm finding that the more I get to know them, the more I understand that they don't want to just follow this cookie cutter recipe. They want to be able to say, hey, this is what we want. This is what we need.
Along those same lines, obviously we have one major health system here in Muskegon County.
Yes.
And I would imagine that requires you to work hand in hand with them as well. So
Absolutely.
Describe that to us, please.
So it's been a blessing as well. I am on the board of the Trinity Health Muskegon Advisory Board, as well as their community benefits agency, which is the Muskegon Community Health Project. So I've had over a 20-year positive working relationship with that group. And it's just great to get together and on a regular basis and talk about the community needs and what's the best way to try to address that. I think, like for me, my jurisdiction, I'm the health officer for Muskegon County. So my jurisdiction is Muskegon County. A lot of our other community partners like United Way, it's multi-county. Senior Resources, multi-county. Trinity Health, multi-county. So sometimes they can bring in ideas and resources that I wouldn't be able to tap into. So it's just a great collaborative partnership that I really believe is the most efficient way for government to do business.
So I cannot have this conversation with you without talking about COVID.
Yes.
And the reason, not so much, the aspect of the disease and everything else, but to really have you talk about your role, but more importantly, your leadership role. Because having been in a lot of different meetings as we were going through that as a community, I was always very impressed with how you handled, the information, how you handled, all the questions and maybe the differing of opinions. I hate to say it, but you were probably the best in the state, if not the nation. And that's maybe a little biased on my part, but it was very impressive. So talk to us about what that experience was like.
I think it was really like my past experience helped me navigate through that experience. So being a middle child and understanding I'm not going to always have my way. So that always helps with the ego to know that regardless of your position, you're coming in and you're going to hear both sides and you may walk away without getting your way. That helped. It helped to already have relationships with our community leaders. So being a part of Rotary and United Way or just volunteering with other nonprofit organizations, I got to know a lot of community leaders. And I also was elevated to leadership roles within those organizations. So there were a lot of people that we already had mutual respect for each other. So it was really easy to just basically tell them the truth. Like if you hear this on the news and it's a little bit sensationalized, it was easier to say, okay, I'm not sure if that's really what's happening over in Seattle, but, we're Muskegon County. We're a little bit different here. And even though all of this is over there, that's not what our data is showing here. I had to constantly remind people this is a novel virus, so we do not have all the answers. And I think there was a lot of political pressure for people to have all the answers. And some people just responded to that as if every answer they gathered was the truth. And I think because I knew everybody, I respected them, I just had to look them in the eye and say, we don't know for sure. And at this time, we think this is the best approach. And also, take care of you and your family. Do what's best for you and your family. And I think my biggest challenge was the judgment of others. And so people would call and complain about their neighbor or complain about this bar. Like they'd say they went to this bar and they were shoulder to shoulder, and then they went back next week and they were still shoulder to shoulder. And I'd say, why did you go back? Like I didn't quite understand that. And so just really trying to help people calm down, actually. There was a lot of chaos and, I guess, creation of chaos around that topic. And we just needed to calm down, understand it is novel, understand we don't have all the answers. And the best we can do is the best we can do at that time. Understanding that we might get more information next week and realize maybe that wasn't the best thing.
Well, I know that you were, I don't know if you slept at all during that year.
Hardly.
So.
I worked 100-hour weeks. I mean, seriously, and I would get calls midnight from superintendents or just business owners that just got notified of a positive case and they just really needed to know what to do.
Well, as someone that had to reach out to you more than once, I really appreciated your ability to respond in a very quick fashion and answer the questions and concerns, and do it as though you were telling somebody for the first time, even though it was probably the 100th time.
It was my pleasure, though. Yes.
But yeah, thank you for your leadership in that. So how do people learn more about, what maybe they've got questions about their own, I won't say health, but their circumstance, whether it be child, infant. How do people find out more about what the services are?
Very interesting, DJ, because that is sort of a new generational challenge for me. We, of course, have our website. We have radio shows and radio ads, but we are not, public health, we are not just really, we haven't really embraced that knowledge of social media, and it's just a little bit different than it was 20 years ago when you can go to Muskegon Chronicle or MLive or these three, like I remember when there were only 3 TV stations. We are challenged with that. And I am, again, being the most senior county employee, I'm also, one of the oldest, and I don't know that I can embrace or even understand how to reach everybody now. Right now, I am trying to find community champions that will help me, that will come in and learn more about public health and then take that knowledge to their community. I would love to know the answer. As soon as we figured out how to get on social media, places like Facebook, like this generation of younger people moved on to something else. And I think it just changed so fast that we have to focus on more community partnerships with local people. We have to figure out how to meet people where they are. So build relationships with naturally forming groups and just ask, can we come in for 10 minutes or so to explain our programs? What I have done since COVID is I have expanded our, what I call the core group, CORE, for community outreach and engagement. And our core group, they are out in the community attending events, just being available, but not pressure, because we had to really slow down and try not to be just this big government regulator to trying to tell people what to do. So we show up, and sometimes people pass us, and then maybe the next time they stop and they ask about it. We have cornhole games by our station, so maybe they'll stop, play a game, and then ask us a question. We have phone charging stations that we bring to bike time, and people will come to charge their phone or electronic device, and they're not going to leave them unattended. So while their phone is charging, they'll look at some of our brochures. We're trying to take this non-aggressive approach. We want to be around. We want to be available when people need us, but we don't want to force our services down anybody's throat.
Well, I mean, public health is important. I mean, it's never going to be an unimportant thing for communities and counties to care about.
Right.
I.e., you want to go to that restaurant and not worry about whether or not you're going to get E. coli or any of the other diseases. I mean, that's kind of important.
Absolutely. You want to make sure that when you're swimming in a public swimming pool, it's been tested and you know that it's operating and maintained according to, safe standards. The same with, your own well and septic. You want to make sure that your neighbor doesn't place their septic system too close to your water well drinking system. That's what we do behind the scenes. We contract with GVSU to monitor our beaches, both Great Lakes and inland beaches, and we post the results, and we issue advisories when the levels of E. coli or algae is unsafe.
So how do people, if they're interested in both public service and public health, how do people get, what direction would you recommend folks to think about, especially our younger folks?
So what's so amazing is, again, public health is a conglomerate of activities. And so if you're interested in biology or sciences, I implore you to please consider a position in our environmental health division. We have 10, and then supervisors in that department. But anywhere from, monitoring soil, well and septic, tattoo, body piercing, swimming pools, restaurants, such a vast array of activities on that end. So if you like the sciences, public health. If you like clinical services, if you like medical, we also have an array. Those are two of our biggest divisions, environmental health and clinical services. But even community outreach and engagement. If you are an educator and you want to help other people be the healthiest that they can be, we need new creative minds to help us reach these new creative people. So a vast array from education, clinical, medical, biology, math. My background is accounting and business. So I feel like we have a job for everyone.
Well, especially given our kind of our earlier conversation, if you happen to be a young person in the digital media sphere.
Oh my goodness, yes.
that expertise might be almost a necessity.
Absolutely. The National Public Health Accreditation Standards require us to be more conveners, community conveners, and strategists. And I think we have really good relationships in Muskegon County. Muskegon County is just amazing, though. We have a lot of collaborative leaders that make my job so much easier because we give them a call and we all just do the best that we can for each other. The strategist is a new requirement, and I feel like, there's a new world out there, and we need new thinkers to help. I can do some things, but we need to sort of uplift our next generation of leaders and be there so that they can try new things. And then I'll just be there to say, it's okay. Let's try it this way now.
Excellent. Well, Kathy, thank you for being with me today. But more importantly, thank you for your 35 plus years of dedicated public service.
And I love it. I do. I'm a servant at heart, and it's just so much fun.
Well, it goes to show, and I think one of the things I'll say indirect things I'm trying to highlight in these episodes is this idea that you can make public service a career.
Yes, absolutely.
And be satisfied in that career choice and have all the things that you think you need in that career.
Oh, my goodness, yes. I feel very empowered, and I'm still not above, like, picking up trash in the parking lot as I park my car and walk into the building. And I don't feel bad about it, and I don't feel bad that somebody threw it down. I know sometimes our clients are carrying 2 kids in the building with a stroller or anything. So, yes, absolutely a pleasure.
Awesome. Well, again, thank you for joining me this morning. Thank you for all the important information. Certainly I think people need to, if they are concerned about any public health issue, always check it out.
Yes.
Always ask
Yes.
questions. Get it investigated.
Yes.
Don't let it lie.
Right. We do investigate nuisance complaints and any other concerns. We do follow up on those.
Fantastic. Well, ladies and gentlemen, boys and girls, thank you for tuning in for yet another, I think, very informative episode of Muskegon County Municipalities at Work. Again, diving into what I classify as the weeds of local government, understanding the importance of the services being offered, but more importantly, the people that are working behind the scenes to make those services work. Thanks again for joining. As always, this program does not happen without the ingenuity of one Mike Vogus.
Thank you, Mike. You are amazing.